Tony Evers and DHS Secretary-Designee Andrea Palm. Also available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases, and Ryan Nilsestoon, Chief Legal Counsel in the Office of the Governor. We'll begin the briefing with remarks from Governor Tony Evers.
Thank you, and good afternoon, and thanks for joining us again. Yesterday, Wisconsin reached another concerning and tragic milestone as we surpassed 200,000 positive cases of COVID-19 in our state. While it took us a little over 7 months to reach our first 100,000 cases, it took us just a fraction of that time to reach our second 100,000. This time it only took 36 days. I know so many of you have been taking precautions and made huge sacrifices, not only for your own health, but the health of our friends and neighbors too, because that's what Wisconsinites do. But here's the bottom line. Well, there are a lot of people across our state who are doing the right things, staying home and wearing masks whenever they go out. But we also know these folks don't exist in a bubble. When one person or a family or a group of people decide they aren't going to wear masks, that they're not going to cancel their in-person plans or parties, that they're going to go about their days and their lives business as usual, it ruins it for everyone else. This virus does not discriminate. It doesn't care where you live, how old you are, or whether or not you choose to believe this is an urgent crisis and an imminent risk. There's no way to sugarcoat it. We are facing an urgent crisis, and there is an imminent risk to you, your family members, your friends, your neighbors, and the people you care about. We need folks to forget "it won't happen to me" mentality. We need folks to stop treating this virus as something that's only happening to other people in other places. This virus is here, and it's spreading all around us. I know folks are tired, and I know there's whiplash because one legal challenge and court decision after another. So I'm going to make it easy. Stay home. Don't have people at your home who are outside of your immediate family or household. Don't host or go to gatherings with people outside of your immediate family or household. Limit your social interactions to a circle of 5, and that means 5 total, not 5 at a time. Support our local restaurants by getting your food delivered or picking it up to go. Support our small businesses by ordering online and doing contactless pickup. Visit your doctor using telemedicine if you can. Go for a walk or a bike ride and some fresh air outside and enjoy what's left of the fall, but otherwise please only leave your house if it's absolutely necessary and essential, like picking up prescriptions or grabbing groceries. We know that practicing physical distancing, staying home as much as we are able, avoiding events with a lot of people, and wearing our masks are the most effective tools we have at this time to fight COVID-19. And the vast majority of Wisconsinites know this too, because folks in every corner of our state have experienced this virus firsthand. And we've heard story after story of folks who wish they would have taken serious precautions sooner. They thought it couldn't happen to them, and then it did. So please don't risk it, because our hospitals and our healthcare systems don't have an option. Every day our healthcare workers have to go to work to battle this virus and care for our fellow Wisconsinites. Our small business owners trying to keep their lights on don't have an option. This pandemic will continue to hold them and our state's economy back until we get the spread of this virus under control. Right now, we don't have any other option. Public health is a team sport. We need everyone to step up to the plate, make these tough sacrifices, and work together to get through these hard times. So wear a mask, stay home, and let's get back to the basics of fighting this pandemic together. With that, I'll now turn this thing over to Secretary-Designee Andrea Palm for her update. And take it away, Andrea.
Thanks, Governor. Good afternoon, everyone, and thank you for joining us. again today. As the governor said, we did pass a milestone yesterday with those 200,000 cases here in Wisconsin, and 100,000 of them, as he said, in the most recent 36 days, which really tells us that Wisconsin is in a crisis. Today, we added an additional 5,262 confirmed cases of COVID-19, which brings our total to 206,311. Our 7-day average of new cases is 3,975. 1 month ago, our average was 2,090, and 2 months ago, it was only 700. In the past 2 months, our 7-day average has increased by more than 400%. With this many new cases each day, our contact tracers are overwhelmed. Hospitals across our state are strained and operating with critical and imminent staffing shortages. We continue to accept patients into our alternate care facility. We wish we didn't need to use this facility, but we are grateful to have it as a relief valve for our hospitals. And our death toll continues to climb. Today, 64 more Wisconsinites have lost their lives to COVID-19. Our hearts go out to the families and friends who have lost these loved ones to the virus. This increase in cases and our increase in deaths today are the largest single-day increases we have seen throughout the course of this pandemic. We must take significant and collective action. We all need to stay home. Do not interact with people that you do not live with. Go out for the essentials, groceries, the pharmacy, your job if you cannot work from home, but cancel travel and social gatherings. We each need to wear a mask. Your mask protects me, and my mask protects you. We need to practice physical distancing, stay 6 feet apart even when we're wearing our masks. And we need to wash our hands frequently. If you have symptoms or have been exposed to COVID-19, please get tested. Quarantine while you wait for your results. Isolate from the people you live with if you test positive, and please help our contact tracers by calling your own contacts and encouraging them to get tested and to quarantine. This is going to get worse before it gets better, which is why we all need to take every precaution we can, because these actions are how we stop the spread and make sure Wisconsin gets back on the right track. Thank you.
Thank you. And we'll now take your questions. A reminder to maintain audio quality, to keep phones on mute until it's time to ask your question. And we'll begin today with Heather Poltrock from WSAW-TV in Wausau. Heather? Again, Heather Poltrock from WSAW-TV. And we'll move on then to Katie Anderson from WB.
Hello, can you hear me?
Hi, is this Heather?
Yes.
Go ahead, please.
This question's for the governor. So we've talked to a few people who say they're still waiting on unemployment benefits and can't get assistance with their mortgage until they become delinquent. So they're currently struggling financially because they're still not working full time, but they say they can't get help. Do you have any advice for these homeowners?
Well, if they have a claim into the Department of Workforce Development, it's our goal, and I think we'll get there with some help from Microsoft that recently became a partner with us. It's our goal to clean up any back people that have been waiting for months and months, and we're in the process of doing this. We have a goal to clean that up by the end of the year and hopefully before.
Thank you, Heather. Now to Katie Anderson from WBAY-TV in Green Bay.
Hello. I don't know exactly who this question would be for, but we know nursing homes are really struggling with staff and keeping staff and patients safe, and that's also a piece of the puzzle on why hospitals are overcrowding. I guess, what is being done right now at the state level to help these types of long-term care facilities?
Yeah, it's a great question, Katie. And I would say a number of things. As you all know, and as we've talked about since the beginning of this pandemic, folks who reside in our skilled nursing facilities and nursing homes have been a top priority. We watched the state of Washington early in this pandemic have really severe consequences in the nursing home setting. And so we have worked hard, as have our partners in long-term care, to help keep these folks as safe as possible, and that has included bringing to bear our state testing assets to make sure we tested all residents and staff. We are now surging those state testing assets to test on the frequency that is required by the federal government, with the aim of keeping staff and residents as safe and healthy as possible. We work very closely with our partners in long-term care on staffing shortages. You mentioned that, Katie. It is certainly an issue, just like we're seeing in hospitals, where these frontline healthcare workers who are caring for these vulnerable folks in nursing homes are being exposed to COVID-19 or becoming infected in the community. And that, of course, means they can't come to work. And so between our testing assets and our some of the staffing networks and databases that we have to help surge short-term staffing resources for them so they can bridge staffing gaps, to the work that we're doing more broadly with them on infection prevention, right? Those protocols and those practices are part of how you keep the infection out of the nursing home on the front end, to a variety of issues that we continue to work on. You mentioned particularly the issue of post-acute care for folks who are ready to return to a nursing home, but maybe that nursing home is facing an outbreak or has some positive cases, and the investigation is ongoing to make sure that the residents of that home are safe, and therefore bringing somebody back into that setting before we understand what all is going on there and what risk we might be subjecting them to is an important time for us to make sure that folks aren't reintroduced into that setting before we know exactly what is going on. And so we're working with regulatory flexibilities and our hospital partners and our long-term care partners to work on expanding capacity so that we are making sure we are utilizing our beds and our surge infrastructure in a way that makes sure we are able to keep these vulnerable members of Wisconsin's communities as safe as possible, while also ensuring that our hospitals have access to bed capacity in a way that allows them to manage their active COVID patients and other patients that they're taking care of now and in the coming months.
Thank you, Katie. Now to Stephanie Hawk from WIS Politics. Stephanie.
Hi, thanks for taking my call today. My question is for Governor Tony Evers. Just wondering what you have to say about the failed attempt to recall you.
Oh, to be honest with you, I haven't thought about it much. I read in the newspaper that they didn't reach the goals that they had set out, and so I've never given up working on this issue and other issues of facing the state, so I didn't think about it much before, and frankly, I'm not thinking about it at all now.
Thank you, Stephanie. Now to Mark Stevens from CBS 58 in Milwaukee. Mark?
Governor, based on your statement, the advice you're giving, and the numbers, would it be accurate to suggest that you're suggesting a kind of a self-imposed lockdown for the state?
Well, if people stay at home, we can call it whatever. I call it saving lives. These deaths that we're having now, and likely in the future, because it's a lagging indicator, can be prevented. And we can prevent the deaths of people in Wisconsin by staying home. If that's considered a self-imposed lockdown, whatever it is, it's important. I see that the White House has given up on this issue, and they're focusing on things that are down the road, which down the road is allowing lots of people to pass away. We're not giving up here, and whatever we can do to encourage people to stay safer at home, we will do that.
Thank you, Mark. Now to Eric Gunn from Wisconsin Examiner. Eric?
Thank you for taking my question. I suspect this question will end up being with Mr. Nilsson. The Attorney General's office issued an opinion today regarding administrative rule promulgation arising from the 2011 Wisconsin Act 21. My question is whether this Attorney General's opinion today has any implications for how you might interpret the Governor's office, the executive branch's ability to deal with administrative rulemaking that specifically would apply to the pandemic.
Yeah, I think it's a informative Attorney General opinion. For those of you who don't know about it, is that the Attorney General opined that when an administrative agency is given a broad grant of rulemaking authority, it can promulgate rules. It's pretty straightforward. And I think it'll be it reaffirms what the law already says and what it should be, and it will give agencies additional tools in order to promulgate rules that are in the public's interests, that are used to keep people safe, in order to keep our water clean, keep our air clean. And in terms of COVID, I think that's something we're going to be looking into. That said, I think the biggest roadblock with administrative rulemaking is legislative Republicans. While they said they wanted a seat at the table, wanted to work with the administration on rulemaking, when DHS submitted a very broad and general scope statement, it didn't have any specifics in it. Republicans flat out closed the door on it. So I think this AG opinion is helpful. Unfortunately, the other side isn't receptive to taking any action on COVID.
Thank you, Eric. Now to Nick Williams from Milwaukee Business Journal. Nick?
Hi, this question is for Secretary Palm, but also Governor Evers. Do you think cases are going to rise rapidly with the capacity limit being struck down, the statewide limit? And then, I guess for you, Governor, with Milwaukee imposing their own restrictions starting that week, do you want to see more municipalities issue their own restriction limitations? Thank you.
So I think broadly that the order was enjoined, and then it was on, and then it was enjoined again, and so the ability of it to really take hold and do the kind of public health transmission, break in transmission that we're looking for out of a capacity limits order really has not been allowed to work, and so I think as we all know, as we've all learned in this pandemic, new daily cases are the result of things that we have done 10 days, 14 days ago, because it takes a little bit of time for them to show up as a positive case in the system, and it's just and it's why it takes another little bit of time before you see hospitalizations and deaths, and so with all of these interruptions and the confusion that the injunctions have caused about is it on, is it off, should I do it, should I not do it, has really, I think, minimized the impact that the order unfortunately will have on the public health. But I think the broader point remains that people should stay home as much as possible, order or no order, enforceable or not enforceable. It is the safest and best thing we can do to stop the spread of this disease, to protect our frontline healthcare workers, to take some strain off our public health infrastructure so that they can do their their work, and to really limit and minimize illness and death that will come from new daily cases today and tomorrow and the following days.
And just from my vantage point, as far as local orders, whatever we can do to be consistent around this issue is helpful, whether that's local orders, whether that's from the White House, whether it's from the Republicans, whether it's from the Democrats. Part of the problem that has put us in this position of having trouble preventing deaths in the state of Wisconsin is that we haven't had a consistent message. And if locals can be also consistent, it's not that the local public health people are very consistent. They're concerned about this also. But whatever we can do locally amplifies our efforts to make sure that people are safe.
Thank you, Nick. Now to Mitchell Schmidt from the Wisconsin State Journal. Mitchell?
Yeah, thank you very much for the call. If you mentioned this, I apologize. I was just wondering if we can get a quick update on the alternative care facility, what the total number is right now, and given the rise in cases, if we're expecting that to continue to grow. Thank you.
Yeah, our census today is 5, Mitchell, and I think as we continue to see cases increase, as we continue to break records in the number of hospitalizations, we do anticipate ongoing need for the alternate care facility. And as you've heard Deb Standridge say on this call in previous weeks, they're in very close contact with hospitals, answering their questions, helping them think through and work through potential transfers, and understand the scope of what the alternate care facility can provide, et cetera, so that they are also able to talk with their patients about a possible transfer. But we do anticipate to continue to need the alternate care facility moving forward.
Thank you, Mitchell. Now to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
Hi, good afternoon. John Erickson sitting in for John. My question is for the governor. Governor, if Democrats should win control of the Assembly and the state Senate in the election, and they voted to give you the power to order a statewide shelter in place, would you do so? Thank you.
Well, we're not going to get ahead of ourselves here. I'm concerned about today and the days leading up to this election and going forward. We have to mitigate this, do everything we can around mitigation. That's why we're calling on people to be safer at home. And hopefully that can be amplified by Republicans and Democrats and others all across the state. We have to have a consistent message. That's a critical thing. I think it can happen, but at the end of the day, it is important that leaders step up and say the obvious. We need to stay safer at home if we want to prevent more deaths.
Thank you, Jonathan. Now to Jonathan Sadowski from Up North News. Jonathan?
Hi, thanks for taking my question. This would be for either Secretary Palm or Dr. Westergaard, but there seems to have been a proliferation of the myth and misinformation that there is some big inflation of COVID deaths in both the state and nation. So would one of you be able to address how the state counts the deaths and just the process behind it to help dispel that myth?
Yeah, thanks. I would turn to Dr. Westergaard to take this one.
Sure. So the mechanism for reporting deaths is through the Reportable Disease Surveillance System called WEDS, which we use for all communicable diseases, and all of the COVID-19 case data that we report every day also comes in through that system. So there's a relatively long list of reportable conditions that if any healthcare provider makes a diagnosis or finds a case, they're obligated to report them through this online system. So COVID case cases are such a reportable condition, and COVID deaths are also reported. So every death that we report is a report of a clinician in a hospital or a medical examiner who has made a determination based on the clinical evidence that a person's death was in part or mainly due to COVID-19. And when that diagnosis gets made, it gets reported to the state, and we report those. So we rely on trained medical professionals and medical examiners to make that determination. They get reported in a uniform fashion through our system, and we report those data.
Thank you, Jonathan. Now to Madeline Anderson from Fox 6 in Milwaukee. Madeline?
Hello. My question is for really either the governor or Ms. Palm. In your opinion, do Wisconsinites have an empathy problem? In other words, the ability to be able to put yourself in someone else's shoes, to understand their perspective. I know you guys keep saying, for months now, wear a mask, stay home so that you don't infect others, so that, we can relieve the overall hospital system so you don't infect your neighbors, your family, your friends, etc. But clearly some people are still ignoring this warning and basically choosing their own priorities over other people's health and safety. So do we lack empathy, I suppose?
That's a great question. Having lived in Wisconsin for a bunch of years, I'm born and raised here, I think Wisconsinites are extraordinarily empathetic. My concern is that when leaders don't act in an empathetic way, whether that's at the federal level or the state level, people are going to follow that cue. I mean, they're deemed to be leaders for a reason, because they influence people's behavior. And if leaders are not portraying an empathetic value, then people that might be empathetic at their core, but they respect the leader and that leader's opinion, that's, in my opinion, where the trouble begins. I think Wisconsinites are extraordinarily empathetic.
Thank you, Madeline. Now to Nate Phelps from Spectrum News. Nate? Nate Phelps from Spectrum? Okay, we'll move on then to Casey Nelson from WTAQ Radio in Green Bay. Casey?
Hi, thanks again for holding this call. This question, I think, is more directed for Dr. Westergaard here. With the state getting these antigen tests, these rapid point-of-care tests coming in, especially going towards schools and nursing homes, can you kind of explain, first of all, how those tests work, and then why they're kind of being targeted more towards the schools and these long-term care facilities? Thanks.
Sure, I'll be happy to talk about how they work. Secretary Palm might have more larger scale picture about how they're getting allocated to other to the different sectors. But in general, the antigen tests are different from the molecular tests. All the tests that we report on our website that we've been talking about since the beginning of the pandemic is a molecular test which detects the RNA of the virus. So it's called a Pcr test, and those are highly accurate, but also very resource intensive, require a complex laboratory setup to do. Antigen tests are advantageous, and they don't require all that equipment or instrumentation. They are simple. They detect a protein of the virus directly. And the point of care antigen tests mean they can give that result relatively quickly within a few minutes. So highly advantageous from a rapid turnaround perspective. The disadvantage is the accuracy. And they're not terribly inaccurate, but compared to the very highly accurate PCR test, they can steer us in the wrong direction. There can be both false positives and false negative tests. So we have to be smart about how we use them and have the capacity to back them up and do confirmatory tests when they're giving answers that we're not expecting suspecting, meaning someone that has a strong clinical suspicion of COVID-19. They have all the symptoms. If they have an antigen test which is negative, then sometimes we do a backup test with the PCR. So they're also much more inexpensive and easy to manufacture. So the hope is that they're going to proliferate, and we'll have a lot more of them that we can use in different settings. And maybe I'll pass it over to Secretary Palm about how what sectors that they're going to.
Yeah, so I mean, I would say broadly, and we've talked about this before, that testing and building our testing infrastructure has been a priority for us. It continues to be a priority for us, and that diversity in that testing is important as we think about supply chain shortages and other issues that we are seeking to balance and make sure that Wisconsinites have access to tests. And so we have received from the federal government an allocation of antigen tests. About 600,000 of those have gone directly to nursing homes. And we have received somewhere around 300,000 additional at the state level that we have distributed to hospitals, and particularly hospitals in some of our harder hit parts of the state. And to sort of piggyback on the pros and cons of antigen testings, one of the things that is really helpful about these antigen tests, beyond the rapid turnaround, is their use in hospital settings as they are managing staffing shortages, right? So the idea that they can do, you've got somebody who's exposed to COVID and they need to go into quarantine, therefore they can't be at work. If you can deploy antigen tests for quick turn testing to help them manage those staffing shortages and minimize them to the degree possible with this kind of test, that's a really important use of that asset as we more broadly in the state look to maximize our capacity and our staffing to manage what are increasing numbers of folks who need hospitalization from COVID-19. So we continue to work through additional shipments that we expect to receive from the federal government that will total, I think, 1.7 million in all, but have been, in addition to what they sent directly to nursing homes, have been prioritizing our hospitals, again, to help really mitigate to the degree that they can these issues of staffing shortages.
Thank you, Casey. Now to Ben Krumholtz from Fox 11 in Green Bay. Ben?
Hi, thank you for the time. We've heard at least one provider in our area is testing for influenza in the same test that people are getting for COVID. What's the benefit of confirming someone having influenza? Should more providers be doing this? And what's the recommendation for someone who tests positive for influenza but not coronavirus?
Yeah, I'd be happy to take that one. So it's highly advantageous to be able to test for both viruses at the same time because the treatment is different. Specifically, we have antiviral medications that we can use for people who have influenza. We can help them feel better quicker, and it's also been helpful in some outbreak settings. So the big challenge about flu season, which generally starts in the fall and goes through early spring or late winter, is that it tends to show up at varying times. We never know exactly when it's going to start circulating. When it does, however, we can expect that the symptoms of influenza are going to be very, very similar to the symptoms of COVID-19. So understanding who has what virus and the downstream activities that go along with that, whether it be referral for treatment or antiviral treatment, is going to be very important. So I expect that a larger number of laboratories and providers are going to be able to use these tests. They're in development. The Pcr test that I mentioned earlier, which detects the genetic material of the virus. We have platforms that can detect for both targets, both genetic targets for both influenza virus and SARS-CoV-2 virus. And when influenza season is upon us, it's going to make a lot of sense to test for both of those. The good news is, as of this week, we've seen almost no influenza, and the southern hemisphere, which usually precedes precedes our flu season had an extraordinarily low influenza activity season. So we don't know what that means. It can give us some optimism that there will not be a great deal of flu that circulates, but we can't guarantee that. So we need to be vigilant and develop systems to test for influenza systematically so we know when and if it's here. But the other lesson from that, which I think is important to recognize, is just how much more infectious or contagious the COVID-19 virus is than influenza. There's a lot of countries in the Southern Hemisphere that had essentially no influenza that have high levels of COVID-19. So the things that we're doing with physical distancing and face coverings and staying home when you're sick are highly, highly effective for preventing influenza, even if we don't do it perfectly. What we're seeing is that if we don't do these things perfectly for COVID-19, it's not enough. So it's just another lesson of why this virus is so challenging and why we need to work so hard and cooperate to such a high degree in order to stop transmission of the COVID-19 virus.
Thank you, Ben. Now to Amanda Quintana from News 3 Now in Madison. Amanda?
Hi, can you hear me? Mm-hmm. Hello?
Yes.
We sure can. Okay. So when Dr. Deborah Birx was here last week, she said UW campuses have been figuring out how to stop the spread because they're testing students weekly and then they're finding those asymptomatic cases. So she suggested that communities do this as well, proactively testing 18 to 30-year-olds on a regular basis. Is this even possible?
Yeah, so I think we're very interested, as we have been all along, in continuing to expand our testing capacity. And as Dr. Westergaard said on Thursday, I think. Our community testing sites, if you've been exposed to COVID-19, you can and should get a test, and you can access them through what are now over 70 community testing sites around the state of Wisconsin. We have worked really hard to push our testing assets into more and more communities around the state to improve access to testing so that we can, as Dr. Birx suggests, pick up more and more asymptomatic cases earlier in disease progression. I think we certainly are not, and no state is in a position to test all of their residents. There is not the test in the United States to do that. It speaks to more broadly the need for more federal infrastructure, a more robust federal plan to assist states so that they're not competing with each other for these very scarce resources. But we will continue to use every asset we can get our hands on to build up our testing capacity, to deploy it strategically, and to do the work that is necessary to stop the spread.
I'd add one thing to that about the campus outbreaks and how quickly they were turned around. So doing large-scale testing systematically provided very useful information, or is a good foundation to prevent infections. But the testing was not what prevented the infections. That's not what stopped the outbreak. What stopped the outbreak was when they found cases, they were isolated. They had a separate dormitory where if someone tested positive, they moved out of their room, their dorm, out of the environment where they shared space with other people, into an environment where they were isolated. One step more than that, if individuals were in close contact with someone who tested positive, they were put into quarantine. There was a separate building where they stayed for 14 days if they were exposed to someone. So the testing tells us how we implement the plan, but the plan, the thing that prevents infection is the separation. It's the isolation and quarantine. So the good news with that is that we don't need to test the whole population in order for that strategy that was effective on the campus to be effective statewide. What we really need to do is be serious about every single case that gets isolated effectively. All exposed people get tested and quarantined. And the other thing that it must be said was really successful on our campuses is close to 100% face covering use in public. I don't think that can be overstated. So I think it was that visit was helpful in shining a light on a success story on how an outbreak that was really growing very quickly was able to be brought under control. And the lessons are the things that we've been recommending, but they were able to do it in a coordinated way with a high degree of fidelity or success. And I think the epidemic curve being turned and flattened is really good evidence of that.
Thank you, Amanda. Now to Todd Richmond from the Associated Press. Todd?
Hi there, can you hear me? Governor Evers, wondering if you had any comments on the U.S. Supreme Court decision on absentee ballot counting last night.
Yeah, that was a disappointment, but not at all unexpected. We've been encouraging folks all along to make sure that they get their absentee ballots mailed in up until a point, and I'd encourage people from here on out to be dropping them off in the drop box or getting them back into a place where there's in-person voting. And because, frankly, that decision was anticipated just because of the makeup of the court, the word has been getting out all along around that. So it was a disappointing decision, but one that was anticipated, and frankly, one that I think we've gotten out ahead of it with messaging.
Thank you, Todd. Now to Sean Kirkby from Wisconsin Health News. Sean?
Hi, thank you for holding this. Regarding the capacity limits that were blocked Friday, do you see any chance of those being put back in place by November 6th? Is there any kind of legal action you're going to take to put them back in place? Thank you.
Sure, I can answer that. This is Ryan Elsastoon. So we're briefing before the Wisconsin Court of Appeals this week. The briefing will be done by Friday, so hopefully we'll get a very prompt decision from the Court of Appeals after that. That said, as Secretary Palm said earlier, with the ping-ponging back and forth with this in the courts, it's definitely taken away a lot of the impact that the ban or the limitation could have had on the state, and I think we're seeing that playing out in numbers.
Thank you, Sean. Now to Jennifer Cleasy from WKOW-TV in Madison. Jennifer?
Hello. My question is about the vaccine rollout plan. I'm wondering how much this is going to cost the state. Will you get any federal funding to offset that? And what is your overall response to the many out there who are not trusting a vaccine right now? Will it be optional for people? Or how will you encourage people to get it when it is eventually available?
On the question of cost, so the federal government has contracted with vaccine manufacturers and distribution company to put in our hands an allocation of vaccines to immunize our population. We anticipate that those will come over the course of time. So a limited supply at first, with growing supply over time as more vaccine is able to be manufactured. So in addition, we do expect things like the syringes and the pieces of equipment that you need to provide a vaccination will also be distributed through the federal government through a distribution system to our certified vaccinators, so that the front end cost will be borne by the federal government. As it relates, remind me your second question. I lost it. I had it and then I lost it. Oh, optional. Yeah. Yep. So absolutely, people, as with vaccinations more broadly, it certainly is at the option of individuals. But should there be a safe and effective vaccine, or more than one candidate makes it across the finish line and is deemed as safe and effective, we certainly will be encouraging all Wisconsinites to get vaccinated. It will be a really important new tool in our toolbox to help reduce this virus in the state of Wisconsin and allow us to get back to something that looks like more normal life, more normal course of business here. And so it will be a really critical tool for us, and we certainly will be encouraging all Wisconsinites to get vaccinated.
Thank you, Jennifer. Now to Natalie from WAOW-TV in Wausau. Natalie?
Hi, guys. So I'm looking at state data right now that shows that 68 out of Wisconsin's 72 counties are experiencing very high case activity levels. And, you know, looking at a map of the state right now, it's very striking to see just only a small portion of the state that's not dealing with the virus on such a level. And, you know, I'm just wondering what that tells you about the state of the virus in Wisconsin and, you know, just that trajectory so far.
Yeah, Natalie, I'll certainly invite Dr. Westergaard to say something here as well. But I think what it really does speak to is intense and widespread community transmission. It is in every corner of this state, and it is at levels that puts us as you said, at this very high activity level. And there are many parts of the state that are 5, 6, 7, 8 times what is the threshold to reach that very high activity level. And again, it speaks to the very contagious nature of the virus, and that a single case turns into 2, turns into 4, turns into 8, and that exponential growth that we have talked about a number of times throughout this pandemic is coming home to roost in communities across the state. But it really, again, it really speaks to what we control in this outbreak is the things we do to stop the spread and the actions we take collectively to protect each other. And that is why, you know, the governor's opening remarks were very clearly focused on making the choice to stay home as much as possible, limiting your contact to people who live in your immediate household. And again, like we did in March and April, limiting your exposure to, you know, to people that you come across doing your essential errands, going to the grocery store once a week and to the pharmacy. And so we have to start using those habits again. We have to go back to the things we were doing in that early spring timeframe if we're going to get to a place where our case growth and our escalation is not that intense, very high activity level that you're seeing right now on our map. But Dr. Westergaard, if you want to chime in.
I don't know what else to say other than the trajectory is 100,000 cases in 36 days, an environment where we still think the large majority of people have not been exposed to the virus. It gives us it's a nightmare scenario, frankly, that this could get quite a bit worse in the next several weeks or months before it gets better. And so the fact that it's already highest levels widespread, and we think most people haven't been exposed yet, is really a concerning scenario.
Thank you, Natalie. Now to Kent Wayne-Scott from WISN-TV in Milwaukee. Kent?
Hi, thank you. Dr. Westergaard and Secretary Palm, with contact tracers being overwhelmed, some local health departments reprioritizing, adopting emergency protocols that in many cases rely on patients who've tested positive for the virus to be responsible for some of the contact tracing. What impact is that likely to have on the spread?
Yeah, I would say broadly, right, and then I'll let Dr. Westergaard talk about the real benefits of contact tracing. I think right, it really is important to understand when you're in a situation where your public health infrastructure can't do contact tracing as effectively as it would like to, as it was designed to be done. It speaks to the need to do everything we can to stop the spread, just like our strained healthcare systems and our frontline healthcare workers who are asking us all to do what we can to stop the spread. And so contact tracing continues to be an important part of the equation, but we have to remember that we control our ability to do contact tracing effectively by the actions we and weeks to stop the spread. But Dr. Westergaard, if you speak to,
I think the practice of engaging cases, provided that they feel well enough to do so, in notifying contacts and spreading the word about what needs to happen when someone's exposed, could have a very positive impact. You know, the standard that we strive for is that every individual who tests positive gets notified, gets contacted and interviewed by a local health. One big benefit of that is it's somebody in your community who cares about you, calling you to check on you and tell you the things that you need to know. Like, we still want to do that, but the notification, the idea that we could crowdsource, you know, telling people that I've been in close contact with and spreading the word. Like, I think if we get to a point where a large proportion of the population sort of understands this, why this is important well enough to help communicate that in collaboration with public health or even in healthcare systems. If this is the biggest crisis that we're facing collaboratively, if we can all understand what contact tracing means, what it's intended to accomplish, and be equipped with the ability to provide that support and advice to people in our communities, I could see that being very, very positive. So we were sort of forced into this in the staffing crisis, but I could see it being a very potentially positive thing if we can get some best practices and disseminate the right education and do it in a coordinated way. So I'm actually really optimistic and grateful for health departments that are kind of out leading this, because I think it's a direction that we can go, and it could be a positive thing.
Thank you, Ken. Now to Rachel from TMJ4 in Milwaukee. Rachel?
Milwaukee's COVID plan lets bars and restaurants whose safety plans have been approved by the health department allow more than 25% capacity. Do you think Milwaukee is doing enough to mitigate the spread with their current plan?
I believe that they just tighten up their plan, to my knowledge, and I believe that the plan is as rigorous as the plan that we have in place. Is that accurate?
Yeah. Thank you, Rachel. Now to Sophie Carson from USA Today Network, Wisconsin. Sophie?
Hi, thanks so much for taking my call. Today my question is also about the vaccine plan. Once the vaccine has been approved, how soon afterward do you expect to begin vaccinating people in Wisconsin?
It's a good question, and I think some of it depends on how much, what the time is between approval and when those first vials start coming off the manufacturing line, and then, do they distribute by state alphabetically? I mean, right, there's lots of variables about from the point of approval to the point it lands in the state of Wisconsin. But we, it is our goal certainly to be ready when those first few vials arrive here, and we're able to start with our priority populations, with healthcare workers, with vulnerable folks in nursing homes, and look forward to an ample supply and being able to vaccinate the population more broadly. But right, there are a number of unknowns about how many candidates will ultimately receive FDA approval, how quickly they'll come off the manufacturing line, and then how soon after that will they arrive here. But we'll be ready.
Thank you, Sophie. Now to Maddie Heim from the Appleton Post-Crescent. Maddie?
Hi, thanks for doing this call. My question's also about the vaccine plan. I'm just wondering, so in the prioritization phases, I saw that it said that phase 2 will expand to other critical populations be determined. And I'm just wondering, how soon do you expect to know what those other critical populations will be?
And Dr. Westergaard may want to say something about this as well, but there's a federal advisory panel that whose standing job it is. They're a long-standing federal advisory committee that provides recommendations on vaccinations, and they look at all vaccines across the board, not just COVID. So they will opine on priority populations as part of their deliberations, and will make recommendations. And then we also here at the state have an advisory committee that is populated with medical professionals, public health experts, ethicists, others who will also provide us with some guidance and recommendations on priority populations that we certainly will, and we'll take all of that into account as we move forward, particularly as you suggest, when we anticipate in the early weeks and months to have fewer vaccines than demand, and we will, as a scarce resource, we will need to prioritize its use in our populations here in Wisconsin.
Yeah, that work is actively ongoing to have a Wisconsin-specific plan for prioritization that we hopefully wrap up in the next few weeks, plenty of time before we have to start delivering vaccine.
Thank you, Maddie. Now to Megan Hart from Wisconsin Public Radio. Megan.
Hi, thank you for taking my question. It's for Secretary Palm. You've talked today about how building testing capacity is a priority moving forward. Last week, a couple of National Guard testing sites, I think one in Rock County and one in Kenosha County, closed early because demand for tests exceeded what they were expecting. As demand continues to grow, how realistic of a concern for you is it that current testing capacity wouldn't be enough moving forward?
Yeah, we certainly, in the early days of this outbreak, as we were just starting to ramp up testing, our demand for testing exceeded our capacity, and we prioritized, right? We prioritized populations to receive testing. We are certainly now at a place where anyone who needs a test can and should be able to get a test, and we see on a daily basis, we have a daily testing capacity over 42,000 tests a day, and we're seeing, a daily average tests of just shy of 30,000. So we still do have some capacity in the system for those who want to get tested. Is why you continue to hear us encouraging people to get tested if they need a test. And as we have pushed our testing resources more across the state in more communities, we want to make sure that access is more readily available, and that we are continuing to build beyond 42,000 tests a day to accommodate the potential, certainly, that we could see testing demand increase, right? We saw it during our surge this summer in the July-August timeframe. We saw that our testing capacity was reaching, or the demand for tests was very, very close to what our capacity was, and so that certainly could happen again. It is why our partnership with the State Lab of Hygiene, who continues to provide technical assistance and onboarding of additional labs around the state to perform tests, that work continues, and we do have labs in the pipeline who will come on board and be able to do COVID testing to continue to expand that capacity. It is why we have continued to expand the contracts we have with a variety of labs to make sure we can continue to keep up and maintain a capacity that allows folks who need to get tested access to a test. But it more broadly speaks to why we need the federal government to work for Congress to pass additional funding for our testing needs, our testing plan. We have spent a large bolus of our CARES Act funding on testing, and we need funding past the end of the year to continue to do that. And so I think we are very anxious to see Congress and the federal government pass additional funding to allow us to continue testing here in the state of Wisconsin at the level and exceeding the level that we are at right now.
Thank you, Megan. And our final question today belongs to Bruce Marcus from WRJO in Eagle River. Bruce? Again, Bruce Marcus from WRJO. Okay, that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.